Hello and welcome to my channel Ace Your MRCP. I am Dr. Aparajita Roy and I am a specialist trainee registrar in diabetes and endocrinology in South East London Deanery. I've recently passed the SCE exam in diabetes and endocrinology in my very first attempt, and in today's video I'm going to share with you my top 5 tips that will help you to pass your SCE exam in the very first attempt. So just at a quick glance, the MRCP SCE Diabetes and Endocrinology exam is a multiple choice based question exam. It has 2 papers, 200 questions each. Each paper lasts for 3 hours. There are no negative marking and this is a pass-fail exam, so marks don't matter. If you clear the cutoff, you get the certificate. It is a certification exam, so there is no training involved as such. You prepare for the exam, sit for the exam, and if you pass it, then you get a certificate. Also, please remember, this is very important, that just by doing the MRCP SCE exam, you cannot get GMC registered. And you also cannot write MRCP as such. You'll have to, in your degree, write MRCP SCE Diabetes and Endocrinology if you want to use it as a post-nominal. The SCE exam, like every other exam, is very easy to pass if you are prepared for it adequately. Only about 70% of candidates pass their SCE exam in diabetes and endocrinology in their first attempt. The exam happens once a year, every year, and it will be in the month of November from 2025, and it costs roughly about £700 if you're attempting this exam in the UK. Now, the first resource I would recommend is a textbook, as I always do for all exams. A textbook is a must to clarify all the concepts in diabetes and endocrinology, and also to get your facts, figures and tables right. Now, the Oxford Handbook for Diabetes and Endocrinology is something which is a must read for this exam, especially all those tables, figures, percentages that are given in the Oxford Handbook. If you have already read a bigger textbook like Williams, you might not need the Oxford Handbook to clarify concepts, because your concepts might already be quite clear from textbooks like Williams, but you still need the Oxford Handbook to get all those percentage and factual questions that they ask in the exam. Sometimes they ask direct fact-based questions from the Oxford tables, and sometimes they ask from even the paragraphs itself. In my exam, I had at least 2 or 3 percentage questions that came from the Oxford Handbook. Now, annoyingly, such percentage questions are becoming more and more common in the exams. Last year, I attended the Diabetes Update Conference organized by ABCD, where there was a dedicated slot for MRCP SCE preparation. Now, one of my fellow registrars asked this question to the presenter: why are we getting more and more of these percentage questions, which are quite difficult to remember? Now, the answer was quite clear, that the percentage-based questions were there for a reason. For example, if a type 1 diabetes patient comes to your clinic and wants you to tell them what is the chance of their baby developing type 1 diabetes, as a registrar, we are expected to know the answer at the top of our head and not needing to refer to a book to answer the question. That is the expectation from the examining body that's preparing the questions for MRCP SCE exam. Now, please remember that the MRCP SCE exam is based on the UK facts figures. So that is why it is very important that you refer to the Oxford Handbook and the NICE guidelines where relevant to answer those percentage and fact-based questions. So, to conclude, even if you have read a different textbook to clarify your concepts, you still need the Oxford Handbook, particularly the tables, the figures and certain paragraphs which are absolute favorites of the examiners to ask percentage and fact-based questions from. The second most important resource that I used was question banks, and I used them side by side with the textbook. What I did was I followed the SC curriculum blueprint that is given in their website that tells me roughly what percentage of questions come from which topic. So what I would do is I will pick up one topic, let's say pituitary, then I would read the textbook and solve all the questions on pituitary from the question banks. For diabetes and endocrinology, the most commonly used question banks are BMJ1 exam and study PRN. I did both question banks, although I found that study PRN was more helpful. Their questions were more representative of the actual questions that was asked in the exam. Although, to be fair, the actual questions in the exams were much harder than the question bank. There were no direct repeats as such, but if you revise both these question banks, you will by and large cover all the topics that they commonly ask in the exam. Also, I would strongly recommend the MCQ book by Prof. Kalhan. It is an amazing book. The explanations are particularly useful to get your concepts right, and that book itself also covers almost all the topics that are commonly asked in the exam. Number 3, past papers. Now, before the start of the exam, every candidate has to sign a non-disclosure agreement where they are bound legally not to divulge actual questions out in the market. However, exam recalls helps the preparing candidate to familiarize themselves with the commonly asked topics. You can join WhatsApp or Telegram groups where candidates often discuss recall questions. Also, I would strongly recommend these set of questions. I did several times before my exam. I actually found 4 or 5 direct repeat questions from this particular question bank. So I would strongly recommend you guys to do this set of question bank thoroughly, and I suspect that this might be an amalgamation of quite a few past question recalls that have been all put together in this particular question bank. Number 5, guidelines. Now, you cannot attempt the MRCP SCE Diabetes Endocrinology exam without going through the guidelines. I know they're annoying, but lots and lots of questions get asked directly from the guidelines, especially like gestational diabetes, ATA guidelines for thyroid, NOG guidelines. So make sure you read at least all the NICE guidelines that are available, at least around diabetes, and also the JBDS guidelines, particularly the DKA, HHS guidelines, variable rate insulin infusion therapies, then the preoperative guidelines for diabetes patients. For endocrinology, please do not forget to read the Society of Endocrinology guidelines, the NOG guidelines for osteoporosis, and I'm sure there are lots and lots of other guidelines, but keep reading as much as you can. Interestingly, in my exam, they had asked a specific question on American Thyroid Association guidelines, which I found a bit odd, but I think they're also expecting you to know that guidelines as well. So it is annoying, but read as much as guidelines as possible and try to use them in your clinical practice so that you don't have to memorize each and everything. Number 4 is SC courses. Now, they are not a must, but in the UK, most candidates tend to do an SC course, mostly because this is covered by our trainee study budget. There are several courses available in the UK. I personally did Prof. Kalhan's course in Cardiff. It was a face-to-face course, and honestly, I learned a lot. It was a good networking opportunity, and I also learned many topics in diabetes and endocrinology, which are not only exam-oriented, but are also helpful for real-life, case-to-case based scenarios. There are several other courses like I mentioned. There is one course in Manchester which is quite expensive. It is an offline course but costs about £1,000, but it's also very highly recommended, so that is something you can also try. Another resource that I used was very useful. That is the YouTube videos by Dr. Mazhar Dalvi. He also has a paid course, I believe, but I didn't opt for the paid course. I only prepped from the free YouTube videos that are available, and I would strongly recommend it. He also does videos on past question recalls, which I found quite useful, and I had at least 2 questions that I directly could answer from watching his YouTube videos. So I would strongly recommend watching them as well. That's it for me, guys. I hope you found this video useful, and if you're preparing for the MRCP SCE Diabetes and Endocrinology exam, I wish you all the best. Let me know in the comment section below how you found this video. Also, of late, I've been doing a lot of one-to-one consultations because of huge popular demand, and I've been also holding a lot of mock interview sessions for candidates who want to come and work in the UK just before their actual NHS interviews. So if you're interested in them, please reach out to me on my email address, which is given in the description box. Till then, stay safe, keep studying, and ace your MRCP.